Okay.
Okay.
Okay. So it's recording again. So just to summarize the elements connected with the members of the human being. But what would be important for this lecture is which element of nature, which can find it being found in nature, has a therapeutic impact on the which member. So as you remember, the minerals, so the most, I would say, solid parts of the earth are working on the ego organization of the or the I organization. The plants are working on the astral body and animals mainly on etheric body. It will be quite important when we will see the therapies. Also, a few remedies, so-called humana, from the I would say human kingdom, but they will mainly work on a physical body. I have a question. Do you see my cursor going on the screen or not? Yeah, super.
Yes.
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 Thank you. So we have in our memory the four-folded human being, and now there's those three systems, which is quite unique for anthroposophy that was developed. So nervous sensory system, rhythmical system, and metabolic limb system. And what I would suggest for you before the next meeting, probably to see a lecture so-called Invisible Man in Us. Because this is, I would say, a very, very basic and super difficult lecture concerning the three and fourfoldness, which we can see also here that the ego organization as a highest member here is going directly in the nervous sensory system, but there it is a bit more loose connected to the whole body. That is why we can think. And also, if we go down with the members, they are going, I would say, a bit more down and down. We will see that sometimes it's a bit easier to explain a disease using this side of the slide, so three systems, and sometimes it's a bit easier to use the four-folded human being. Taken from the anthroposophic dermatology book, what I would like to emphasize that with the nervous sensory system, it works mainly centripetal, so it going from the outward into the human being. Also, the main thing we can see is the senses, so we can perceive the outer world through the senses. So through the senses, it's a bit going into the organism. And as a contrapole to this, there is a metabolic limb system which has complete opposite directions of working. So it's works centrifugal from the middle outwards, and it is also, as you know, connected, for example, with our thinking, so we can perceive our thoughts, and so connected with the outer world. And the second pole is more connected with the will, so the limbs are the most, I would say, visible sign of the will that we are acting in the world from the inside. And what is important regarding the skin, as you can see below, we have these two polarities of nerves and blood, and through the nerves and from the outside world, a bit more forming activity is coming. So the human body is being shaped a bit from the outside also, and we will see in skin diseases how the form activity will occur. And on the other side, we have this bloodstream going from the, I would say, this middle outside. So it is pushing the activity outwardly, and it is connected with more substance-like activity, a building up process. So The form is a bit demolition process, destruction process, that it creates a shape in a matter. And when we look at the skin, a regular, I would say, schematic scheme of the skin, we can see also the three different systems. So the nervous sensory system acting mainly, not only, but mainly in the epidermis, where we have this, I would say, death process. So when the keranocytes, like here, when we have the stratum basale, so this is the pole of the epidermis where there is still a lot of life. So cells are dividing very strongly and quickly. They are step by step losing their nucleus, their cellular organs, and they are becoming just, I would say, the cell walls connected to each other. But this is extremely important for the skin because, as we will see in neurodermitis, atopic dermatitis, the skin is, I would say, a barrier organ for the whole organism. Also, we can see the rhythmical system. It is mainly focused here. So the main thing is the muscles and the vessels, and also some, glands, but they are also different ones are a bit connected to the rhythmical or metabolic limb system. And subcutaneous tissue, so-called hypodermis, it's strongly metabolic limb system connected with the thermal regulation, creating warmth. So the main metabolic activity, as you remember, the nervous sensory system is more connected to, I would say, coldness of the human being. So the head is a bit of a cold pole in human organism, and the limbs are and belly, abdomen is a warm pole. And also we can see this in the layers of the skin. It is a bit more histopathological scene. So we can see a very, very, very structured tissue here. It has to have a life, because otherwise it wouldn't be able to be created. And going under, it's more a bit chaotic, not so structured. The fibers are going sometimes in a different directions. So my main theme was today to focus on two main, I would say, polarities. As an example, it will be atopic dermatitis and psoriasis, but afterwards, today I thought maybe we could do also the acne vulgaris, so the common acne, because it's, I would say, quite often encountered by many different specialists. So neurodermatitis, atopic dermatitis. Why I choose this? Because it's occurs very, very often, up to 15% in European Union in children. So children in the, I would say, developed or developing countries are more affected by this disease. And as I said, the skin is this border organ, this border of the organism, and it is a beautiful example of atopic dermatitis as this skin border. Of course, we would be able to talk about all these different criteria that are connected with atopic dermatitis, but what is most important is that it makes skin itchy. It has its typical locations, and it's a chronic disease. That's three is, I would say, enough for us to see atopic dermatitis. And as in anthroposophy, we would say that the health is a middle point in the human organism. And when the process is going right, it can go to atopic dermatitis. And when it will go left, for example, it can go to psoriasis. So what I want to say that these criteria that you see, that's quite a lot of them, and they show us that it's a process of disease until we are here. We have all the criteria, I would say, and then we can say, yes, this patient has atopic dermatitis. But basically, in anthroposophic dermatology, you will see this tendency in between. So you have, for example, only one criteria or only two, and you cannot say, in the light of academic medicine, this patient has atopic dermatitis. But you can see that the skin here has this tendency, and when some extra factors will come, it can develop the atopic dermatitis. So as a dermatologist, I can say you that you can see these tendencies on the skin, not only I would say the diseases. And a bit of qualitative considerations, how you can understand atopic dermatitis, is that organism, it's, I would say, more or less closed entity within itself. And the other pole is, of course, external world. And this line here may represent for us the skin, but not only the skin, also mucous membranes and so. So where the organism is meeting the external world. And of course, as we saw, these two directions, one from the one side and one from the other. And when they are in the balance, there is no problem, we can manage. When one of the directions is going too much, in this case external world, the organism should be a bit more pushing outside also, and it is still this state of health, but a bit going with these tendencies that they can occur. And what is happening when our skin, so this border, is not working rightly? Well, basically then the external world comes in, says hello, but organism doesn't like this external substances, external processes, antigens, so-called, and it has to make a reaction. So I would say, to understand first atopic dermatitis, we have to think that there's some bit of a problem on the border when they meet together. And we can see that we have few different aspects of this border not being created completely good. So on the one side, we will have a lower building activity. So this metabolic limb activity is too small, and that is why the form activity from the outside is coming into the organism. And we can see when building up activity is not working well, we have cirrhosis, so the dry skin. We have sebostasis, so the sebaceous glands don't work properly, which will be contrapositive. On the contrary, it will be in acne, that they work too intensively. And we have, which is very important, a bit thinner subcutis, so the hypodermis, so the subcutaneous tissue is a bit thinner. When we would like to see this form activity, which I mentioned here on this picture, we can see that some new forms are being seen on the skin. For example, so-called Denny Morgan sign, which is a line being created here under the eyes. And I think afterwards we have some pictures. Yeah, we can see it here. This is this Denny Morgan sign. So it is extra form on the normal skin. Another example, hyperlineary hands and feet. It's also like in this picture, we can see that there is too much form. So this extra human activity is coming in and forming too much. This is also a typical localization for atopic dermatitis. And with this form activity, it is closely connected, this nerves activity, but we can a bit divide them aside. So just acting of the nerves. So the most important sign of atopic dermatitis is itching, especially by sweating or after or during the shower or in a very warm room and so. Dermographism, because it's there are two kinds of dermographism. You know, dermographism is something when you take your pen and do it strongly like this, and it creates a line there. And why the dermographism? It says that it will be a white line. There is also a red dermographism connected to urticaria, so it is completely different mechanism. But in white dermographism, we can also see this too much nerve forming activities because the artery vessels are just being constricted. And that is why the skin in this localization is being white, like without enough blood. And there is, I wanted to show you, because in atopic dermatitis, the therapy, regular and anthroposophical, are, well, you could see they are almost the same aspects, but in regular therapy, the main therapy is being focused on emollient therapy, so to make skin more watery, to fill the gaps, I would say, because the dry skin there, it's making a gap. So when we would like see this as a normal skin, so the dry skin looks like this. And through this skin, there can come substances, bacteria, antigens, external world basically, and creating this reaction that we would say. So emollient therapy in this sense, it's something that helps us, but doesn't solve the problem. And also topical treatment. Why not systemic treatment? Because basically nowadays regular atopic dermatitis treatment is consisted of you using steroids or very strong immune suppressant drugs. And it is not likely to be used very often. But on the contrary, in anthroposophic medicine, we can use systemic therapy because we will be working from inside of the organism, so it can build up the skin, that the skin will be, I would say, normal. But what is always good to emphasize that education is in this therapy the main thing. What we have to watch out for, what we have to care about, the allergens, the irritant factors, and so and so. But I don't want to make it, quite regular dermatology lecture. So I focused on the anthroposophical therapy, this systemic therapy that we can use. And as Meron said to me that you had quite a lot of workshops regarding the remedies. So I don't want to go very deeply into them, but if it will be necessary, we can do it also on the second part. What I would say would be the most valuable thing is that we can see in this threefoldness, we can also see this threefold options of the therapy, which is quite good because then we can start our therapy or influence the different members of the human organism. And for example, from the metal or mineral side, I would say the silver is the most important in atopic dermatitis, as the skin, from the physiology, it is very connected also with the moon, because when our way of the epidermis, of the epidermal cells starts here, it takes about 28 days to come here. So as you know, the lunar cycle is also 28 days, and that is why when we have this too much forming activity, too less life in this sphere. In the disease, like in atopic dermatitis, it is always good to start with silver. I would say the lower potency from D3 to D6, it's always good because it helps to rebuild the epidermis. So when we have these gaps, it helps, to give force to make it again very strong and not permitting structure. Also, from the point of view of allergology and this border aspect, calcium is quite good example to help to close the skin. But basically, it's not good to start with calcium at the moment because you have to first rebuild it and then you can, I would say, close it. So calcium you can use a bit afterwards. Bryophyllum or Kalanchoe. I think you all know the plant. I forgot to put the picture of it from my, I would say, from my apartment. But you know the Bryophyllum that it creates a new plants on the leaves. So this shows us a very strong connection to the life forces, that it doesn't have to have a seed, it just goes in the life sphere on and on and on. And there is a very special preparation from Veleda called Bryophyllum argentoculta. So we have a connection between those two. And I would say it is very nice and most effective thing in children, because it's a watery dilution, so we don't have any alcohol. So for very small children, as we saw, it's up to 15% of children, even more now. It is very good to use this kind of preparation. So we know that metal or mineral is working on the ego organization. So preparing the ego organization to go through this bloodstream to rebuild. The plant is also connected with astral body. So again, this from, I would say, this invisible man in us, this stream going very, very down and going up, this upbuilding process. But we also can work directly on an etheric body. So this body that is considered to have this healing force and this building up a body, I would say. And there I would say it's very good to use organ preparations. In Poland, we use, for example, mesenchym calcium carbonicum comp, which is a very special preparation of 4 main organs. So the lung, heart, kidneys, and the liver. There's also pancreas, and there is also mesenchym, as the name, so the tissue in between, inside the skin and the mucous membranes, and so it is, I would say, a direct impact on the skin. Also having these 4 organs supporting the upbuilding processes, and we have very good experiences in, I would say, also acute forms. I know there's calcium, but we cannot get everything from Germany that we would like to have. So sometimes we also use this mesenchym calcium at the beginning in a very, very acute state. Afterwards, we are finishing using silver, and then we can also help build up the process. Conche is also something connected very much with calcium processes, but in a special way, because in conche, it's oyster shell. So we can grasp this etheric body directly, not through these all 3 stages, but to do it directly. And for example, apis, as you know, the bee is, I would say, most effective in acute inflammatory states. And we will see this also, for example, in acne, that we are using this in very acute red itching phases. And here on the bottom, there is Gentiana lutea and Cichorium intybus. There are 2 plants connected very strongly with with digestive tract, because it is very important to know that at the beginning, the atopic dermatitis is strongly connected with, I would say, diet. And we can see that, for example, cow's milk, or they are inside casein, and so different proteins, but not only, also different other, I would say, the substances or antigens can go through the digestive tract, and the liver has to find, I would say, its way to push them away. It can do through the gall, but in atopic dermatitis, it usually sending these substances through the skin, and also the skin is affected when the diet is, I would say, irregular. Well, it's not a bit artificial, so we can see in patients that when the diet is not good, the skin is also very bad. I had, I have a very small son, 1.5 years, and when I was away and somebody gave him, I don't know, a sweet or something like this, immediately after 2 days, he was almost all covered with atopic dermatitis. And using the therapy, I used basically the mesenchym, calcium carbonicum, and apis D30, because it was very inflammatory state. Afterwards, I used Bryophyllum argentoculta and calcium quercus. Basically, after 1 month, and the diet was again good, he has a completely normal skin. We don't have to use any emollients to cover the body, because he doesn't need it. But it is until the time that again somebody will give him something that will make the skin, I would say, bad. And it is very important in working with patients, this education sphere. So to find what makes the skin worse, and to avoid it, basically, the therapy is never easier than that. So that I would be as much for the atopic dermatitis therapy, and to see the counter image a bit, the metabolic limb systems disease, psoriasis, also one of the most often occurring diseases in adults in European Union, up to 3%. And I just put it here, the pathogenesis, because it's very, that people like to see this genetic, autoimmune, and metabolic. Basically, that these two, autoimmune or metabolic, are the main theme of psoriasis. Of course, always you can find some gene that will be connected with some disease. Atopic dermatitis, psoriasis, acne, everything. But nowadays, also there is something like epigenetic mechanism. And this is very nice, I would say, for the anthroposophist to see that normal medicine was focusing on the genes. Okay, I have found the gene is bad, so we will have a disease. But basically now, we can say that, and anthroposophists would say, of course, your habits, your diet, and everything what you do is the most important. So there was quite a big gap between those two, I would say, points of view. And now the academic medicine is going into, I would say, something which is very popular now, this epigenetic mechanism. And as it turns out, through the diet, habits, and what we do in our life, we can, in a very substance molecule way, influence the genes. So basically, when we have something like psoriasis and we can find the gene that it is not working good, we can modify it by the diet, for example. I would say in dermatology, the diet is the most important treatment that we can ever see. In atopic dermatitis, in psoriasis, and as we will see in acne, and more other diseases. So how can we see the process of psoriasis? basically we can see that there's too excessive metabolic process. So the upbuilding process is dominating. So as we saw here, this direction from inside outside, it's coming up, and we can see this basically in lesions because they are red, they are above the skin, they are making also this scaling process, which is also a bit of forming process, but I will explain this a bit later. But this redness, this building up process is what we can see in different other, not only psoriatic patients, but when we see, for example, lichen planus or something, when the skin is building, rising up, there we should search for the metabolic limb dominating aspects. And it is well known that these epidermal cells, as I said, they cycle from the stratum basale, so from the life layer of the skin, going upwards to the dead sphere. It takes 28 days. But in psoriatic patients, it's like 4 days. So it is building very, very up, and this death process is not strong enough. That is why we can see this. And as a secondary reaction, we can see that it's make this squama, this white lesions, this forming lesions, because they need to go to this, I would say, death sphere, this sphere in normal skin, which is here. And in psoriatic patients, it's extremely bigger one. We'll see the histopathology in a few minutes. No, I think it shouldn't be here, sorry. Or maybe, yeah, sorry. It is like this red blood processes from the psoriatic is going to the external world, and it is here creating a not efficient barrier. Here, I would say, would be the line of the normal skin, and this building up process is going too much into the external world. From the book from Luther Jachens, Dermatology, we can see this polarity in those two diseases. So psoriasis versus neurodermatitis, atopic dermatitis, blood versus nerves, centrifugal versus centripetal, what we have seen. And also it is, for the dermatologist, quite interesting to see that atopic dermatitis usual location is flexural areas, so when the elbow is going to flex. And for the psoriasis, it's completely different location, completely opposite. As we said, the form-giving forces, processes, and substance processes building up and destruction, and which is quite interesting as also a polarization to white dermographies, Kübner's phenomenon. It is something when we scratch our skin and make a little destruction. When the psoriasis is active, it will build up here a new lesions, and they will spread out from this point. So when we are damaging the skin, this building up, healing, I would say, process going too much, creating the lesions of psoriasis. And of course, as you can see, the hypertrophy and hypotrophy, they are the opposite sides of these two diseases. And on the left side, we can see this psoriatic lesions. On the right side, atopic dermatitis. And what I wanted to say, that the biggest trick in dermatology, especially anthroposophic dermatology, is to find which aspect is first. So either it is nervous, sensory system, or metabolic aspects. Because when we will see this picture here, it's easy. We can see the main metabolic aspects. But when we see here, we have this squama, the white, and we will say, okay, it's too much of forming forces. Yes, but it's a secondary. So the primary is metabolic, and secondary, it makes a contra reaction to this nerve forming synthesis. And also it is the same with the skin of atopic dermatitis. Here, the primary is nervous sensory system aspects of the disease. So too much form giving and so. And afterwards, when this too much form is penetrating as foreign bodies, as this bacteria, as antigens and so, it is creating this inflammation. So the process from inside outside with this metabolic aspects. And basically we can have a patient that have the both aspects as here and here, but the primary and secondary is different. And it is, I would say, very important to find out which was the first, which was the second, and then we can find the, I would say, real therapy. And to compare also, because I wanted this lecture to be, a bit bridge building between academic knowledge and anthroposophical knowledge. So that is why I use the histology pictures. On the left, we have psoriatic skin under the microscope, and on the right, the atopic dermatitis. And here, basically, we see the inflammation. So there's a lot of going on there. And also here is the inflammation, so-called Kogoi pustule. So this is this common thing, but here it is the secondary and here is primary. But which is most important in psoriasis, that the epidermis is very, very thick, basically, because when the cell cycle is 4 days instead of 28, so here it's 28, it's going very, 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 very slowly. And here we have a lot of life. So this metabolic aspect in epidermis is too excessive, and we can see it as it's growing very deeply. So basically, for the atopic dermatitis therapy, we need to help to build up, for example, with the silver and organ preparations. And for psoriasis, we have to slow it down. And that is why in psoriatic patients, I would say we would use the things that will a bit killing too much life activity, but to come to the middle. And arsenicum album, for example, is a thing that it helps astral body to work directly into the organism. So direct working of the astral body and the ego organization will work from this pole, so nervous sensory system, going much deeper in the organism, as they are doing in psoriasis, and suppressing this too much life forces. Also, sometimes we can use silver as a sulfur as a help to go into this process, but and plumbum, which we can do also in Noirly, it is lead. It is this connected very closely to the nervous sensory system metal. And as you can see, I put here the animal, but we don't use them very much. Basically, we use mainly the apis or formica, and the apis as an anti-inflammatory remedy, and formica to get rid of too much also life forces and the things that the rest of the substances that will be in the skin. And from the plant point of view, there is very nice colchicum, which is very usually used in different autoimmune diseases, for example, thyroid gland or Hashimoto disease. And something which I found it very interesting to investigate, Thanatopsis vulgare, it is a very common plant in Poland, Of course, I didn't take a picture, sorry, but for the next meeting, I will just put the picture and you will see that just seeing the plant, you can almost see psoriasis in the nature. So this upbuilding process, the metabolic process in Tanacetum is very strong, and we can use it also as a very good remedy. And as I have found out in very old medicine, it was sometimes used for psoriasis too. So yeah, basically we will use in psoriatic patients metal or plant therapy to help ego organization and astral body to make this suppression on the mainly etheric body. And just at the end, I would say the acne. Why? Because as we can see, almost 90% of young people, well, especially in Europe, but I would say in Israel, I think it's also quite often. And what I can say, genetics, everything we can be caused by the genes. And it is, of course, true. We can see the families of patients that, for example, grandmother had a big acne, mother has a big acne, and the children have a big acne. Of course, there is this a bit genetic line, but it is, as we said, not the most important one. In acne, the most important is, again, the diet. Of course, the hormones, this adolescence period is very important too, but it's usually 3 to 4 years with the acne to occur then, and then it goes away. During this adolescence, the astral body and ego organization is trying to have a better, deeper, and stronger relation to etheric and physical body. And that is why through working of the hormones, we can see the different changes in a human being. But afterwards, I have a lot of patients 30 or even 40 years old, or even about 50, and they have acne-like problems or just acne. And they say, well, basically I'm 40 and I look like 20. Well, which is sometimes a good thing, but they are very irritated because they don't have, the clear skin. And there, I would say the most important is a diet. So we don't have then the hormones, the storm of the hormones during adolescence period, but then we can see very deeply how the diet is working in the skin. And according to Luder Jachens, we have also 2 ways of working. So hyperkeratosis of the follicles. So it is the thing in the skin, the follicle will be here. And hyperkeratosis is that the skin layers are not losing up. They are too strongly connected, and they make here this point to be closed, as we will see just in a few slides. And it is, I would say, this forming activity. So hyperkeratosis is this forming nervous sensory activity, and sebaceous gland hyperactivity. So this part of the follicle here, creating too much substance. And when we have closed our skin by the nervous sensory activity, and we have still this building up activity, so then it can, I would say, grow in this way. So here, open comedon is where the hyperkeratosis is seen. This black dot here is the sebum that is being oxidated, and it is, I would say, from the patient point of view, they see, oh, but I have this black spots. They are very point is just so the it is a bit. Will go the skin.
Marek, just a minute, please. I have here too many disconnections with the internet. Is it also with the other?
Okay.
The last few minutes I missed with the internet.
Yes, so am I.
And now is
Marek, can you please repeat?
Yes.
There were too many disconnections with, so can you please repeat on what you said on the last slide?
Yeah, okay, yeah, no problem. So I've I would say this was the point when the people were disconnected, somewhere here on the acne or still on psoriasis.
On the acne,
Yeah. So to get a bit again, so acne is a very often occurring disease in especially young patients. And as I said, we can always find the genes as this very bad things in our organism to create a disease. But most important are the hormones and the diet. In between those two, the diet is mostly important. And according to Luder Jachens, we can see the two poles of activity within the skin, the acne skin. So hyperkeratosis of the follicles. So maybe I will use this pictures. So this is a follicle, and here just at the very superficial layer, we have the layers of the skin as we saw here. Yeah, so it has to be loosed up and freed, I would say, in the world. But in the hyperkeratosis, they are connected too strongly, and they are closing up the follicle. So then we can see this black spot on the skin where the comedon is being closed, not completely, and the sebum that is not going outwardly enough is being oxidated, and that is why this is this black spot. But afterwards, this activity closes up the follicle, and this upbuilding process occurs. So this metabolic lymph activity of sebaceous gland is creating substance, more and more and more substance. And this is what we can see in a closed comedion. And when the process is going more and more deeper, it is creating a cyst. So it's a bit bigger. And then even it can create very big pustula and they are so-called a bit under the skin cysts. We can see these all stages here at the bottom pictures. So the black spots are the open comedion. This is not so bad situation. This is the closed comedion situation, and this is this cyst pustula-like lesions. So basically, we can see the whole process of starting with hyperactivity with two sides, connecting and finishing the process in this thing. And from I would say, therapeutic point of view, in the skin we can use silver and antimony as two main, I would say, metals. And in acne, it is very, I would say, a bit more individual to use metals, because there we can try to find the metal regarding to the constitution. So as you know, iron versus sulfur, the blonde or dark hair person. So when we have a blonde hair patient, we will mainly use iron, and dark haired person will use sulfur a bit. And the quicksilver, it is very interesting metal in acne therapy, because it can have this anti-inflammatory effect, and it is, as we said, I don't know if you got it, because the connection, I said that in this adolescence period, the astralic body and ego organization are trying to have deeper and better connection to etheric ones, so that they will be working together very nice. But this is this time of storm of the hormones. This is the sign of coming together. And quicksilver, as you know, Mercury was I would say, the connector between the gods. So it can help us to regulate, this process. But coming to this very individual therapy of acne, I would say these two plant remedies, Tormentilla and Menodoron, are very connected with the women cycles and the women hormones also. And I haven't pointed out here in different remedies, extremely important is liver therapy, because liver is also this organ that helps to connect and to find balance between the higher and lower members. Basically, you can use hepatodoron or different preparations, also like gentiana or helidonium, to strengthen this balancing activity of liver. And animal therapy, we would use basically only these two in the inflammatory state. So apis and lachesis is a kind of a snake poison. Snake we would use to go anti-inflammatory in the skin when we have this situation. So here we would use a bit more this apis belladonna. This is Erisidoron from Veleda, or Apis belladonna cum mercurio from Vala. They are very effective. And when we have, for example, dark-haired patients, we can use sulfur in Erisidoron second, and they give us very good outcomes. In my practice, I also use equisetum cum sulfuretostum, so it is the combination between sulfur and equisetum. I don't remember the English name now, but probably you have heard about equisetum before on the seminars. If not, just give me afterwards some information, so we can also go a bit deeper in some remedies. And ovaria, it is the organo preparation from the ovaries, and it is also mainly used in female patients. Basically, you can use Menodoron and ovaria in different time of the cycles. For example, in the first half Menodoron, in the second ovaria. And when you see the composition of Menodoron, it has achillea, so works on the liver, capsula bursa postoris. Origanum majorana, very closely connected to women reproductive organs too. Urtica, a lot of iron, so also this anti-inflammatory effect. Quercus, as closing up a bit of the skin, not creating so these pustula things. So I think that I would like to come to an end with this acne therapy. I know everything was a bit compact, but when you see the whole lecture, you will see these poles that I was trying to show you, and how from this, I would say, typical diseases for the different poles, you can search and think when you see a patient, for example, with different pustules, first think of the diet always, but then you can use a bit of the acne therapy to also suppress this building up activity, or when you see the psoriatic autoimmune diseases like lichen planus and others, you can search for the therapies connected a bit with the psoriatic patients. And here, also, according to Luder-Jachens, we have quite a lot of different diseases connected with the different activity. And for the second meeting, I was thinking, what can I tell you about? Because now you have the basis to diagnose by yourself what kind of disease you are dealing with in the examination room. And from this, I would say, small list of different skin diseases, I was thinking about telling for sure nummular eczema, because it is very often in atopic dermatitis patients, and it is extremely difficult to treat. Rosacea is also very often in adult patients. You know, this is this a bit of rushing, the redness here on the face. And I thought maybe alopecia areata, because it's also quite difficult to treat, and sometimes it can be very very severe, and it can cause also psychiatry problems, and so, because we don't have hair basically. And also, when you will see those three as an example, we will also see these polarities and how the processes are going. I would also like to say something about systemic sclerosis, so-called scleroderma. Basically, it's a very rare disease, but there you can also see very nicely how these primary and secondary aspects are working. And I put a lot of my studies on the systemic sclerosis because when I was working in a hospital, in our department, we were known in our city, and not only in the city, that we have a lot of systemic sclerosis patients. And that is why I also made my PhD on these patients. But it is extremely visible how these systems are working. And this is very extreme and severe disease, but also it is very, I would say, on the pole, very wide from this health state. So that's why I would just quickly show you how you can understand systemic sclerosis also, and maybe if you have the wishes to go into more special remedies for the skin. We saw silver, and so in skin it is very often used, but there are some preparations, for example, dermatodoron from the Rudolf Steiner indications, and it is like a basic basis remedy that you can use when you, for example, don't know what as a basis. You can also start with dermatodoron. So I would say it would be good to send some questions to Meron, for example, by the end of the week, so I can have time to prepare different ones, because it doesn't have to be those 3 or 4. Basically, what interest of you will be there. So I think we can make this 10 minutes break.
Okay, so shall we meet in well, here in Israel it's 6:27 again. Okay.
No.
Yes, 27. Okay, so see you in 10 minutes. Bye.
Yeah, see you soon.
Marek, I think we shall be patient and in 1 or 2 minutes I hope everybody will come. And shall we give 10 minutes for questions and or 15 minutes is also okay?
Yeah, 15 is also okay.
Okay. Okay, so maybe we shall continue. Now it's the time for questions, and so if anyone have any questions, so please, that's the time. If no one have, I have some. And Noah can't open her microphone, so I'll call her.
I have a question. בינתיים לשאול משהו, מירון?
כן, בטח.
So I have a question about how do you see the relation between the gut and the inner epithelium of our body and the outer epithelium, like the skin, and what is the connection? How can you, as you said, like the main treatment is nutrition and diet. So also, like, if you have any recommendations of diet, and how do you see the connection between the gut and the skin?
Yeah, I skipped one slide in my presentation. That would be, I would say, a bit of an answer. Maybe I will just try to go then once more and to show you the slide that is missing. Can you see the presentation?
Yes.
Oh, yeah. So basically, in my practice, I very often see it is known in acne. Well, maybe not so known because some gastroenterologists are so and so for this bowel-skin connection. But I can see in acne, especially the adolescents, but also adults, that too much carbohydrates, so sweets, chocolates, and so, they are acting on the liver and they are suppressing this liver activity, which is the main, I would say, one of the main therapies in acne. Second one, fast foods. So the things where we have put a lot of chemical things, conservants, dyes, things that will taste better, smell better. So it is, very compact, and this basically in general works very in a destructive way on a bowel activity and on the liver also especially. And what is, I think, one of the main thing in inflammatory bacterial diseases of the skin, but also not only bacterial, but it is most seenable there, too much protein. Rudolf Steiner has said that maybe in future we will be able to see that with the bad diet, the more infectious diseases are coming. And I, as a dermatologist, can very strongly see it on the skin. So basically, I would say that there is a normal amount of protein that our bowels will digest good. And when the proteins, for example, for the persons who are on the gym or just they eat a lot of meat or milk or so the proteins amount going up, and the digestion capability the bowels are also a bit higher, but not like this. So we have this side that is not being digested correctly, and it is also being digested by the bacteria, the fungus, and so, and they are creating a bit of toxic substances. And then we assimilate the toxic substances and we have to put it out somewhere. So the liver, as I said, is putting this out through the skin. And it is not only that the substances are there, but it creates a basis for the bacteria to enter. So I would say in general, in acne, you can very nice see this connection between bowels and the skin. In atopic dermatitis, it's a bit different because there the digestion is not enough in general. And you can see it, for example, as I say to my patients, that there is different fields of digestion, the substance digestion, the emotion digestions also. So in atopic dermatitis, but also in psoriasis, but atopic is very seeable, when the stress comes, the skin is worse. So also this substance digestion is not working good enough, and the liver is pulling the not completely digested substance through the skin. And also not completely digested emotions can also make the skin worse, also like in asthma. Yeah, so I hope it answers a bit of your question about this connection. And also, for example, in rosacea, there are some studies that shows that there's something which is called SIBO syndrome and rosacea. They are quite strongly connected. Yeah, but maybe on this topic we can talk a bit more in the next meeting. So I hope the question was a bit answered.
I have two questions. Is it possible to ask?
Yeah.
It's about atopic dermatitis. Well, the first one is like this. What would you change in the nutrition or diet of a breastfeeding baby, infant, that has atopic dermatitis? And the second one, do you have any recommendation for external preparation for this situation?
Yeah. So I will start with the second. I would say the first thing of the good external application is a bit tricky thing because you can always be, I would say, allergic to some content of the ointment or the cream or so. So it's very difficult. For example, Veleda has very nice Weiße Malve cosmetics. So there is the which has very nice numbing aspect, and also the Borago with ceramides are not in the skin of atopic dermatitis patients. So we use quite oftenly as I can make my own ointment or cream. So sometimes we use a lot of I would say calcium ointment, like 1% calcium in a very neutral ground of the ointment, or basically you can use almost half, 50% water, 50% of the basic ointment that is very neutral. So that is why you have, you make the skin more watery, and it helps to close the gaps. So in my experience, the Weiße Malve from Veleda works very, very good. The calendula is also good, but sometimes people are allergic to calendula. And there is also a very interesting preparation. It's not as a general cosmetic, but a bit more on the of the healing ointment. It's called Imlan, and it is from the Birke. It's Betula.
It's the livne. I'll say it in Hebrew. The livne אירופאי שלא גדל בארץ. It doesn't grow in Israel, but okay.
Yeah. So it also has a very good anti-inflammatory and anti-itching qualities. But you can always start with something with calcium, and if maybe I have some time in future to know a bit more the plants that are growing in Israel, we can also find something. I think also aloes could be something that would have a good effect. Yeah.
Okay.
And to the first question, it makes a bit of a problem during the breastfeeding because, but I work also as a pediatric dermatologist and also with a pediatrician. And we say it's a bit better to breastfeed as long as you can than to stop breastfeeding because the atopic dermatitis. Of course, we have this spectrum of atopic dermatitis. It can be a very slight one and it can be a very severe one. But we are making this it like this, that we are also treating the mother. So, so we are giving the mother the treatment to strengthen her digestive tract so that she digests good, so that the very good digestion substances are going to the milk. That's one. And sometimes we also using because some remedies are on the alcohol dilutions, and sometimes we are giving it to mother to give it to the child through the milk.
Very good, thank you.
Yeah, but I would say the main thing is to keep breastfeeding as long as you can.
Thank you.
Can you please repeat the external treatments that you said in just the names? You said calcium, but you said one treatment by Vereda and another one. If you can just repeat it,
yeah,
please.
Maybe I will write it down. It's Weiße Malve, Calendula, and Weiße Malve is, I would say, the best for the atopic dermatitis. Calendula, I would say it's the second choice, and Imlan Creme Pur, because we have two different Imlans. Creme Pur says that it is without urea. Urea is a substance. The uric acid, urea, that is also in urine, but it helps the skin to collect water. And sometimes when we have a very red skin and we give urea, it will be more itching and painful. So when the skin is open, I would say, so we have lesions, we have scratching, and so don't give urea because it will always be painful. You can give urea, so Imlan with urea, for example, after the skin is closed. So for the starters, the Imlan, so this Betula cream, Imlan Creme Pur, so without this urea substance is the best, one of very good choices, I would say. But it's very, very individual. I can tell you the best emollient, and for example, it won't work. But Weiße Malve, I didn't have any patient that was allergic to. To Calendula, I have one patient that was allergic to. Yeah.
Marek, one of the topics that we are speaking in our last lessons are the potencies. You mentioned quite a lot of medicines for also for the atopic dermatitis and the psoriasis. Can you say which potencies you use for each one of them?
Basically, the most of them are lower potencies. So from D3 until I would say D8 or D10, silver and so. But there are some exceptions. Apis, it is very good in atopic dermatitis to use high potency. I use very often D30, the Apis ex animale. And there was also a lead plumbum for the psoriatic patients, and I use plumbum silicicum D20. So, but basically, for I would say general therapy, you would be able to use lower potencies, but in the individual therapy, when you want to go a bit deeper in the constitution and so, you have to also see which would be sometimes the better. Yeah, like with plumbum or well, Apis in general, the 30 is very good anti-inflammatory and effects has this effect. Yeah.
When you use the silver that you mentioned in treating atopic dermatitis, should be the first line before the other ingredients, or together with all of them? Because they said it first causes the reconstruction of the epidermis.
I usually combine it with the others.
Okay.
So I, for example, use silver or Bryophyllum argentoculta in the younger children, and to combine it, for example, with this organo preparation of mesenchym. And for me it works, and when it is very inflammatory, I use also this Apis D30. So you can start with those three, and when the inflammatory side is lowering, you can skip the Apis D30, for example, and go into calcium. Yeah.
Okay, thank you.
Yeah. Marek, I would like to mention the Enotera argentum culta. You mentioned the Enotera. The Enotera in Hebrew is Nera Laila. That's the name of the plant in Hebrew. And I just wanted to mention it because it might be also possible instead of Bryophyllum argentum culta.
Yeah, that's true. Hello?
Yes, there was disconnection. Can you please
hear me?
Yes, now we can hear you, and maybe we shall try to go to the end.
So I didn't spoke much about Enotera because we have some problems in getting it in Poland. But I would say Bryophyllum and Enotera will be quite similar in treating atopic dermatitis. For example, with Bryophyllum, it have also this calming effect a bit, like Bryophyllum 50% and so. And Enotera is a bit more giving this moisturing effect for the skin. Also, the Enotera oil in normal medicine is very like to be used in very different skin diseases, but you can also use the oil or the creams with the Enotera oil. but yeah, that's I would say there are two that you can use. We mainly use Biofilm because it's easier for us to get, but Enotera would be also very effective. Meron, microphone.
Yeah, sorry. Okay, I think we can continue to end the session, but Mark, if you can say a few words about the Module 2 seminar for pharmacists that you're going to do in Poland, so maybe some people will be interested. And just the dates and the...
So last year we had a training in Krakow, which we recorded. The recording's quality, well, it's maybe not the best, but soon it will be available. So we can also I would say, make a participation and get the certificate afterwards. And it was about Tria Principia, so a thing that we today a bit made. So this salt, mercury, and sulfur aspects and how they are connected with these three systems of nervous sensory system, the rhythmical and metabolic limb systems, connected with 4 human members and the elements. So that was the thing of the first week of training. And this year in June, it will be more online training because Albert Schmidli, our main lecturer, cannot come to Europe. He will stay in Thailand. And we will be talking about 7 metals. And he will be showing also the experiments like we did last year also with salt, mercury, and sulfur. So we will do the 7 main metals. The lectures will be from 20 to 26th of June. And the flyer will be, I think, maybe in this week ready. So I can send it to Meron and send it further to you. So if somebody would be interested, we warmly welcome.
Okay. Arek, I would like to thank you for the condensed and clear lecture and the wonderful comparison between the conventional dermatology and the anthroposophic point of view. And I would like to ask the participants to send me questions in the next, let's say, 3 days, and then I can deliver them to Marek, that he can build the next lecture in 2 weeks from now, exactly 2 weeks from now. So thank you very much again, and see you in soon. Bye-bye.
Thank
Thank you very
you.
much.
Yeah, thank you.
Thank you.